Okay, in a recent video, I showed you guys how to face pull and expand your upper palate in your mouth. This will help balance the face, help like not elongate the face and bring more of this bone structure forward. We're gonna be doing a different type of face pulling today where we're going to be working with a cranial nerve, your trigeminal nerve, which sits right in front of the tragus here in this spot. This is your smiling nerve. This nerve branches out into 3 different areas of the face: the inside of the mouth, the cheek, the tongue, the eye area, and the feeling on top of the face. So this can help balance your facial features, especially if you're experiencing something like a droopy smile or a crooked smile. A lot of the time I've seen this happen to people who've experienced immense trauma. Your face just droops, whether you've experienced a stroke and didn't know it, whether you have Bell's palsy and didn't know it, or you've just experienced massive trauma. Your face will literally hold those emotions and your cranial nerves will turn on and off, which will create this asymmetry in the face. So we're gonna learn about ear pulling today. We have a lot of videos on my page about ear pulling, but in those videos we are specifically working with cranial nerves to calm your work with your parasympathetic nervous system and calm your whole body. Today we're going to be working on lifting the face, creating more blood flow, working with the sphenoid bone, which sits directly behind the eyes. This bone can shift in the skull. It sits right behind the eyes. It works with all of the musculature that helps your eyes have peripheral vision. When you have diminished peripheral vision, or you have a lot of tension in your skull and those muscles don't have full rotation and mobility, or you're looking down at your phone or your computer all day, this puts your body into a heightened state of fight or flight because we're not looking around us like we would in a primal situation. This drives the nervous system up into a situation where it needs to protect you. So by working with the ear and working with the trigeminal nerve and the other cranial nerves that live in this area, we can have a lifting effect and also balance this bone if it's been tilted either way or tilted either way. And this can create a homeostasis feeling and a balanced, more almost therapeutic effect in the whole body. But again, it's going to create facial symmetry. So it's going to be this motion with your fingers. We're going to be pulling apart. You need to be patient here. You can't just get in there and rip. We're going to be working both ears. I'm just going to show you one. You may find yourself swallowing, coughing, taking deep breaths or sighs. You may hear cracking or popping, and it shouldn't be painful. It should feel like you're cracking your neck or your back. And that's just these sutures creating more space. The occipital coming out, the parietal bones opening up and expanding, the frontal lobe opening up. These temporal bones get really tight on a lot of people who grind their teeth or have TMJ issues or just poor hip mobility. These are going to take the brunt of that tension, this orange area on the skull. So to begin, we're going to be hooking in the ear, the whole of the ear, and then on this part and pulling away, almost in a diagonal fashion like this. And again, this is gonna have a lifting effect on our brow because we are creating more blood flow and circulation to where these cranial nerves sit that control the musculature and the nerves on those areas of our face. So to begin, we're gonna do about a 15 second hold, and you're just gonna kind of let your body adjust. Again, coughing, sighing, taking a deep breath. These can all occur, and this is just part of your nervous system settling. So I just had a swallow, removing some lymph fluid. And from here, I'm going to use a little bit more of an intense pull. And then I like to take my ear here, this like thicker cartilage part, and pull up. You can also fold the ear in half and pull away from the face. This is going to have a lifting effect, but again, it's going to reduce tension. And then the next part we're going to work on is kind of this connection area where these 3 parts of the skull come together: the occipital, the temporal, and the parietal. So we want to work on these connections that sit right behind the jaw, where again a lot of tension can occur in either the neck, the brainstem, the neck, the traps in the shoulders, or literally just in the musculature of the face. So working with your SCM muscle, this side sternocleidomastoid muscle can be helpful, but actually like rubbing out tension and doing hair pulling or taking your knuckles and kind of working the fascia here. Now, we're not looking to create pain, we're looking to relieve tension and increase blood flow. So don't do anything that's going to extremely hurt you where you're wincing in pain. But I'm gonna go ahead and do some skin pulls through hair pulling. And you can move your head around while you're doing this and try to release the tension. Or you can just take your knuckles. I like to take my thumbs like on the back of my head like this, and see these little ridges here? This kind of mirrors the back of your pelvis as well. So getting your thumbs here and working this area can help take tension out of the low back and the glutes. So really just working the head. You can't really do anything wrong unless you're creating pain on purpose, but getting into this area. If you actually sit your thumbs back here and you're holding your head and you sit it right in that little groove, take a look around. You will feel those muscles move. The muscles on the back of your neck are huge helpers in your eye mobility and the peripheral vision you have. So when we have a tight neck and we have restricted peripheral, that drives our nervous system into fight or flight because we can't see if danger is coming. So loosening up the musculature of the neck and face can give you greater peripheral vision and eye mobility and get you into a parasympathetic state so your body can relax and heal. So, friendly reminder, you're gonna hook inside of the ear hole, do both sides. You're gonna hook on the upper part of the ear and we're pulling diagonally, 20 to 30 seconds each ear. See how you feel after one side. Do you feel more calm? Do you feel more lifted? Do you feel more blood flow? And then move to the other side. Leave a comment below if you have any questions.